The vision was to really use technology to help you make the most of life. You should have access to treatment and medication and follow kind of a pharmacotherapy-based approach to treating a problem where that is appropriate. But you shouldn't really stop at that, and you should really also figure out what it is that you should be doing from a behavioral perspective. Now, that all sounds great. So for me, the vision always to bring together medication, diagnostics, access to experts, and then digital tools that can help you help yourself. 30% of the UK adult population is now obese. The touch points that you need to have to actually figure out where that person is, to find the right pathway that they need to follow, you need to approach it in a way that is complex. And the only way that you can do this at scale is if you figure out ways that you can use technology that are safe, that still let our clinicians do the best job that they can.
Hey everybody, this week I'm joined by Sokratis Papafloratos, the founder and the CEO of Numan, which I'm sure you've all heard of. So Sokratis, welcome to Healthtech Podcast. How are you doing, sir?
I'm doing very well. Thanks for having me. It's good to see you.
Excellent. Yeah. Whereabouts are you speaking to us from today, Sokratis?
I'm in our London office in Farringdon.
Very nice. How long have you been there now?
A couple of years actually here. We've kind of rotated a little bit in a couple of locations in the area, but yeah, Farringdon has been home for a while now.
Yeah, team's grown a fair amount over the last 6 years, I suppose, hasn't it? Needing to fill bigger and bigger spaces.
It's true. You know, our first office was, I think it was something like 6 people, and it was a room in an office that was being renovated at the time. So I got us a really great deal. But I had to carry water up the stairs every single day because there was a working toilet. We had a toilet, but we didn't have a kitchen for about 3 months. So nice. This is definitely a welcome, change from that. It feels like a long way away.
Nice. Well, yeah, it wasn't actually that long ago, and yeah, looking forward to getting the story because obviously Numan's doing so much it's done so much already for men's health, and I know it's. You look after men's health, but you give knowledge to everybody. You're a hugely content-generating organisation. So, it'd be great to get the story. But first of all, I want to hear about you and your background. So, I obviously know some of this story, and yeah, some of it is wonderful and fascinating. So, I'm looking forward to everyone hear it. So, by all means, I'll give you the floor. Why don't you tell us the long version? Tell us your story.
Thank you. It's you're too kind. So, I'll give you the. Where shall I start? So, as you can tell, I didn't grow up here. I grew up in Greece, in Thessaloniki, where that's kind of where I spent my, if you like, first 18 years. And I had, from a pretty kind of early stage of my life, I had a pretty good but rough idea of what it is that I wanted to do that involved kind of building something. I was never one of those, had a lemonade stand, or I sold DVDs or maybe videotapes. When I went to school, actually, DVDs did not exist then. I wasn't like an entrepreneurial kid, or I didn't come from an entrepreneurial family, or in fact, all the family stories from people that had tried to do something entrepreneurial always ended up in horrible failure. So. If anything, it was not something I was encouraged. A lot of cautionary tales. But those were like generations ago. But anyway, I kind of grew up in Greece, and then I came here in 97 to study engineering in York. And after I did that for about 4 years, came to London, started a master's in information processing and neural networks because I was very much convinced that I was kind of the philosophy on AI and the theory of the mind and the way that machine learning would evolve. For me, I was like super convinced that this would be transformational. I was really kind of keen to learn more about it and do something in that space. I was a little bit too early at the time. We're talking about 2001. So I got this scholarship to do a master's in the Department of Mathematics at King's College, which was completely irrelevant to anything that I was interested in. So unfortunately, I never really finished that degree successfully, but bizarrely ended up with 2 job offers at the end of it. One was with a small kind of company that was building machine learning tools for weather prediction, super early days. And the other one was Vodafone. And me kind of being a bit more sensible, I knew that I wanted to create something and build something and start my own company. And I had that very clear conviction from till I was about 15 or something. But I thought, I better go do something first and maybe learn a thing or two, maybe make a little bit of money first. That felt like a good idea. So I joined Vodafone as a kind of graduate in the telecoms part of Vodafone. Quickly, I did an internship for a CTO when I was kind of in a graduate program. And then after that, I ended up in the global strategy team of Vodafone in about 3 years' time. And then I had a kind of fork in the road moment where I was invited to apply for the global leadership program there and sort of follow an executive career at Vodafone. So I did the only thing that made sense. So I quit and I joined a startup that had just opened an office in London. That was in 2005. So a startup that had been funded by Sequoia at the time. And I had absolutely no idea who Sequoia were.
Wow.
Or what a VC was at the time. It was, but I did some research and I thought, this seems like a good, at least from a kind of risk management perspective, if it doesn't work out, I will learn a bunch of stuff anyway. And I spent there about a year. And I was telling this story to somebody actually yesterday. I thought that I would spend some time there and just see what this whole creating a company was. And I did learn a ton of stuff, but the biggest lesson that I took away was the founder of that company, who was and is like a really charismatic individual. He had a PhD from Stanford. He was like just a super cool dude anyway. He had just raised money from Sequoia. He was very impressive. But then when you go to meet him, he was actually just somebody that was smart and kind of driven. But he didn't have anything that was, out of this world, extraordinary, right? And for me, that was the big confidence, if you like, booster in terms of you know what? Yes, okay, it is a high bar to do something like this, but it is not an extraordinarily high bar that is, you can't reach. So I spent about a year and then I started my first company, which was in the local classifieds space. That was local classifieds powered by user-generated content. So we were the first to do this in the UK. And I started that business in 2006, grew it to profitability, and then eventual acquisition by Yell Group, the Yellow Pages company, in 2010.
Of course.
Yeah, exactly. You don't see many of those these days. And at that point, I was, I think I was 31 at the time, yeah. And I had just completed that plan that I had set in my head when I was about 15, 16, come here, study, do something, learn, grow a company, scale it, sell it. That was as sophisticated as the plan was. And then it was a little bit of okay, so what exactly do I do next? So I took about a year, maybe a year and a half, probably a little bit too long to figure that out. But I just, I had worked so hard in those years. It was a pretty, tough, as you can imagine, first business, navigating the financial crisis of 2008. That was an interesting time to go and launch your Series A, which of course we couldn't raise. Wow. So anyway, it was amazing, a very rewarding experience. So I took a bit of a break, did some investing in businesses like Count.com, Secret Escapes, a few other less successful ones. And I kind of was looking what to do next. And that's when I first started thinking about what led to Numan now, which was kind of, you could see at the time how we were starting, you could see that health was becoming a lot more holistic in a very secular way, that what we call now wellness or well-being were becoming really shifting the way that we were thinking and acting and kind of spending money, but it was a little bit too early to do that in 2012. So I did another business, which was a different way to promote well-being, which was effectively connecting you, getting you closer to the people that matter to you through private sharing of messages, videos, photos. And that was a business that we built for about 3.5 years. We built a great product there, great community of users, great traction, but we just couldn't really we couldn't achieve escape velocity and kind of build like a really viral product. We couldn't really monetize very well.
And there's a critical mass, isn't there, or something like that?
It was, in hindsight, we did so many mistakes that were just so obvious to see. But the problem there was we were getting a lot of false positives because we were using the product with our friends, our families, and the usage was super high. The feedback was very strong. We had users that were extremely passionate about the product. And but in reality, we should have pivoted away from it or walked away from it sooner than we did. Also, we were building it in the wrong place. To do a business like that, it was really, you need to move to the Bay Area. That's where you could really get the kind of capital that would give you the time to really figure things out, or the ability to navigate the path for the company. London back then wasn't really ready for a business like that. These are excuses, by the way, right? Soft excuses around. It's not really what really mattered at the end of the day. At the end of the day, we're just executing on the wrong idea with the wrong plan, and we were not learning quickly enough, and we were in denial for longer than we should have been. That's the actual reality of what happened. We had an opportunity to kind of go down the acqui-hire path at that point, but we decided to just, life's too short, just to walk away from it and wrap it up and shut it down. So then I took another small break, and that takes us now to about 2018, which is, I went back to that original idea. The world had changed. Regulation had advanced, technology had advanced, but really crucially, consumer behavior and expectations had shifted. So it was the right time to be starting a business like Numan, which is what I did, and that's 6 years ago, and that takes us to now. In the meantime, I became a father, got married, started kind of another separate parallel track. Kind of weird to call it separate, but it certainly is different to just being 27 on your own and starting a business.
It is. I've got that joy to look forward to from December, which is when our first is due. So looking forward to. Thank you. Yeah, looking forward to the chaos. Let's just say, but it's a really interesting journey, man. I think the thing that I'll pull out. I want to get into talking about loads of health tech stuff with you, but there's one thing that I just want to pull out of your journey, which is that you talked about kind of seeing what was possible by a normal person is what gave you the confidence to start a business in the first place. I think that is a privilege that is just not afforded to enough people. That's, I guess, my hypothesis, because I think there are people that are so passionate about something needing to change in the world that just sort of assume that that's how the world is, and don't end up learning that normal people can start businesses, and normal people can start very successful businesses, by the way. And you don't need to be a superhuman. To your point, you actually got so close to the founder that you saw that, hey, hold on a minute, this founder's a normal person. Yes, talented. Yes, smart. Yes, all of these things. But actually still, a normal person can raise from Sequoia type vibe. I just wonder if you agree with me that that's a luxury afforded to the few. And actually, I think the world might be a little bit of a better place if more people thought that they could start a business around something they wanted to change in the world.
Yeah, the advice that Sol, who was the founder of that business, gave me was that the most important thing is common sense and judgment. It's not intelligence. And common sense, judgment, character, persistence are a lot more important than whatever kind of special skill you might have, or kind of raw intelligence, right? Or whatever it is that is supernatural. And you get, like, when you think about it over kind of a period of time, if you are the most talented, the smartest person in your team for kind of a prolonged period of time, then either you're building something by yourself, or I don't know, you're an artist or whatever it is that you're doing. But you need to have the drive, you need to have the kind of the energy and the conviction and the kind of the push to make things happen and to start something from nothing. And you need to be comfortable with failure. You need to be comfortable being uncomfortable. You need to have, like, all the more, if you like, emotional aspects of it. But those are universally available traits. And also you need to, I think, also want to do it. You really want to actually make this happen, and not necessarily convince yourself that you should do it a little bit too much for the wrong reasons, right? But yeah, most entrepreneurs that are, of course, don't underestimate everything else that we just talked about, but they are not, the most necessary results for success.
Yeah, and actually that's part of the reason that I do this podcast, actually, to show everyone in the health tech world that, hey, there's normal people too, and you're a normal person, and like, we're normal people.
If this guy can do it, anybody can do it.
I was going to say that, but I thought it would be too offensive. So no, but it's true. It's true though. Everyone's got weaknesses. Everyone's got strengths, and actually, I do honestly just believe that there are so many people that want to make a change that I think if you're just close enough to a founder to see that, hey, if they can do it, so can I. Hopefully that's partly what this podcast does. But let me move on to some health tech stuff, because you're absolutely right that 6 years ago, it's probably sooner than I started to see it, even actually, the world, you noticed the world starting to change, that wellness started to become far more in the zeitgeist. Human behavior started shifting around what we describe as wellness. Spending, crucially, started to certainly change. Can you just zoom in on that time for me? What exactly was it that you started noticing? And I guess the reason that I ask this is because this really forms the foundation for you spotting what was a fundamental change in the way that humans were doing things in this country, which was actually what was the space for what Numan, and now plenty of other platforms as well, was to become.
It's hard to actually go back and be very, if you like, deterministic or causal about these things, because you get so much stimulus that is just happening and change that is happening at the global scale as well, right? But the things that I could see being true back then was, if you think about from at a global scale, we are paradoxically spending more time in suboptimal health now than we used to do a generation ago. We are living longer, and again, this is a little bit of a misconception, not a misconception, something that is not that intuitive and obvious. Like, we all know that we're living longer, but perhaps that end of life stage is kind of, we spend it in ill health and
less healthy
medicine,
years,
less healthy, and they keeps us medicine and science keeps us alive for longer. But the reality is that actually a lot of people now in middle life are spending it in suboptimal health, because you have epidemics like obesity, epidemics like stress and anxiety and depression, and all of those things that are just making us iller. They are making us miss out on kind of life now and life in the future. And those were trends that you could start somehow shifting from. And people, they think about, is it the rise of social media that is kind of precipitating some of those things? Is it kind of changes a kind of how we're evolving as society and as species? I'm not really sure. It's hard to kind of disentangle some of that stuff, but you could see where modern life was taking us. And you could also see the reaction to that would be people really starting to embrace a very different mode of actually being healthy. They would start becoming a lot more interested in their health. They would start becoming a lot more participative in their health. Of course, you could see also people getting a lot more educated than were before. Information became much more readily available, and that has happened absolutely everywhere. And the things that you want as an, or at least I wanted as an entrepreneur to spend time on, were something that I could be personally interested and motivated in. And this field for me has always been fascinating and something that, at the personal level, interested and engaged in. Something that was an interesting problem to solve, and also to stay engaged with it for a very long period of time, because the problem would just shift and change and evolve itself. And also a place where you could really build a really significant, successful, large business and company as well. And it was kind of the intersection of those things that made me zero in on that. And then, you go a little bit by intuition and gut feel that you have, and you feel your way through and iterate. And at some point, hopefully, that vision that you had from the start meets the reality that you're faced with, and you get the timing of that wrong, and you go too soon, you won't get it right. You get it wrong and you go too late, you've missed the opportunity. And to be honest, this is where luck plays the biggest role, because it's impossible to figure any of that stuff out, right? I think we have been, we've not been unlucky, let's call it, and we've had a few things kind of break our way in general. And COVID, can't really speak about COVID and what happened in a sense that it was in any positive terms. But COVID was a massive catalyst for not only businesses like ours that are, let's say, digital first and they benefited from that, but because of access, but because also COVID it brought to reality a very stark realization the importance of actually actively engaging with your health. The other stuff that is really interesting, and again, it is kind of you see it a bit in culture, and you see it and you hear it, is kind of how behaviors, especially amongst men, have been shifting when it comes to alcohol and smoke abuse, when it comes to actually pursuing a healthy lifestyle, when it comes to thinking about nutrition, thinking about sleep. Nobody would be talking about those things in the 2000s or 2010s. And now you can't really escape those conversations, which is great.
You're right. It's been an absolutely fascinating shift to observe. And even the word wellness has, I think, started to take on quite different identities. It's interesting, the collection of things that you mentioned there. The vision of the company was basically out of this idea that people aren't living well, in inverted commas. Then they've got unhealthy behaviors: alcohol, smoking, poor nutrition, poor sleep, other things, the areas of health that require optimizing in order to live best. But it's interesting, isn't it? Because thinking about the positioning of Numan and what you have become, these are a collection of things that people, well, first of all, they've been poorly understood. So from a timing perspective, the information around them has got more and more. And secondly, there are so many people for whom these things are affecting significantly, but seemingly they fall below a threshold that they could get help on an NHS, a publicly funded healthcare system, which we have in the UK. And it's interesting because, no one likes to talk about health in terms of commercial opportunity and things like that. But you could read commercial, but you could also read impactful. There's a place there where there's a potential for impact, isn't there? And there's something that needs to fill that space. So when you're thinking about that vision and the reality that it then became, What was the idea in order to fix that problem, which was there are so many people living not their best because of these things? What was the vision for what you wanted to achieve? And then what was, I guess, the first iteration of that, and how did it develop?
Sure. So the vision was to really use technology to help you make the most of life, to make them to today, right now, but also the future you and the future life that you would have. So help you really, it sounds kind of a little bit corny, like be at your best right now, but also put you on a trajectory that in the next few decades of your life, you would end up in a very, very different place when it comes to being healthy as you aged, as opposed to kind of, if you let the natural kind of gravitational pull of life pull you to a different place, right? A lot of kind of that language and that thinking now is captured by longevity and kind of the conversation around that. But if you think about it, it is about kind of your health span curve and kind of bending that upwards, elevating it from where you're now, and then putting you on a very, very different trajectory. So how do you go about doing something like this, right? Well, I believe that the way to actually, and when I say I believe, this is, if you read, because I'm not an expert, I'm not a doctor, I'm not a clinical professional, but it is fairly commonsensical, and I think we all understand it, that you need to understand risk. You need to understand what are the things that might, kill you in the long term or actually might kill you in the short term, and see what you can do about that. So figure out a way to understand where you are right now. You need to understand kind of things that may not be existential risks, but actually getting in the way of you making the most of life right now. And you need to understand kind of the things that you can do about making those things better, right? And in most cases, the commonsensical approach is that you should have access to treatment and medication and follow kind of a pharmacotherapy-based approach to treating a problem where that is appropriate. But you shouldn't really stop at that. And you should really also figure out what it is that you should be doing from a behavioral perspective. Now, that all sounds great. So for me, the vision always to bring together medication, diagnostics, access to experts, and then digital tools that can help you help yourself, and do that in an integrated, unified way that really understood you as an individual, charted a personal, tailored path for your optimized path to health that include both the drugs and the behavioral change. I didn't believe that you could just apply a behavioral change model and kind of a digital therapeutic only approach, and that you couldn't actually also start by just offering medication safely and making it more accessible. And that all sounds exciting and interesting for me, at least, or for a number of other people, maybe you and let's say a smaller part of the community. But if you walk on the street and start talking to people about, optimizing your health today and tomorrow, and kind of bring together like everything that I just talked about, most people will actually completely ignore that or walk on. Maybe a few people will engage, and then fewer people will actually fully do something about that. Now, that is changing, and that proportion of kind of the groups of people that are actually actively want to engage in what I just described, that has been completely transformed in the last 6 years. But most people they have a problem, and they want a solution to that problem with a minimal amount of effort, for sure. However, they also do want to be educated and informed so they can make their own decisions, but they do not want to be overwhelmed. So they want to be able to start, to continue, and to kind of get a message that they can digest, absorb, and make actionable. They do want to have the supervision and the access of a clinical professional, but they don't want to go through barriers and gates that actually dictate the decision-making that they believe they should be involved in. So they want access, and they want trust, and they want to be able to engage with that part of the healthcare ecosystem, but do it in their own terms. And they want to be able to go through that kind of initial, if you like, step and solve the problem. But then they're also interested in engaging in a deeper journey, provided that you engage them at the right moment, in the right way. Now, that is a difficult problem to solve, and that is kind of human nature, and it is kind of contradictions. And the way that I think about that, and we think about that sometimes, if you think about in a commercial kind of model, you have to solve both the supply problem. How do you create an integrated, seamless, holistic experience and ecosystem around health? And arguably that is the easier problem to solve. And then you have the demand problem, which again, in healthcare terms and in health terms, demand is a little bit of a kind of, it's a difficult subject to approach. But you need to find kind of people that are willing to engage. And crucially, you need to have like a commercial model as well, an economic model that works. Now, that is a fascinating problem to solve. And the impact that you have in when you start making progress on those, you're starting to see it now become a reality. Again, with obesity that I mentioned earlier and the treatment of obesity that uses pharmacotherapy combined with behavioral change, including also a diagnostic component so that you can understand your overall impact on your health, is when you start seeing those things really come into place. What I just described doesn't really work for hair loss. It can work for erectile dysfunction, but you need to find areas of health and of problems that are a little bit more complex. So what we did is we started at the simplest places that we could start, where you could start treating patients safely, and you could start actually also lay down the groundwork for, we've been working on this for 6 years, and we're now a business that is a healthcare provider. We operate and own kind of our own pharmacy and parts of our supply chain. We've built a brand that is recognized by a significant, number of people here in the UK. We've done, I don't know how many mistakes during that time, wrong turns that we had to kind of navigate, raised a whole bunch of money, build a team. It takes time to do all of those things. And we were able to get to that point by just starting small and simple and iterating, and then keeping in mind that kind of bigger vision and laying some of the guardrails and decisions that we made early on, make them in a way that would point us to that bigger direction, that bigger vision, not just the short term of what we wanted to do as a business.
Definitely. Let's talk about men's health a little bit, because you've mentioned a couple of things there: erectile dysfunction, hair loss, some things that I guess particularly hair loss that men would struggle with. It affects the way they look physically, it affects their mental health. Again, you find a way to treat these relatively safely, and you find a commercial model, which means that people are willing to pay for something, therefore it has value, at least to them. So was men's health always somewhere that you were going to start? And if so, why? What was it about those conditions? I know you've said, there's you can treat them, you can find the model, etc. But is there a personal connection there to the reason that you started and began in men's health?
It's something that was a bit of a intuitive understanding of some of those issues. We started, with sexual health for men, and we've all kind of experienced one form or other of the problems that we're dealing with. We understood also a little bit more the end patient and some of it's always very dangerous to kind of extend from personal experience, but at the same time, having deep empathy of the audience and the issues and some of the behaviors, it kind of helped you a little bit more. Like the work that we did on where we positioned the brand was very much kind of work that we did internally with a lot of just reading and thinking and debating and trying to land at the best place that made sense to us. You could also see that there was a place where there was a lot of inertia and inhibition towards doing something about problems that were undeniable. If, let's say, you want to help somebody with their hormonal health, a man or a woman, or somebody that displays symptoms that are related to your hormonal health, that's a much more difficult problem to start with. If you want to help somebody with something that is related to their mental health, the diagnosing part of the problem is harder. Now, in the case of erectile dysfunction and hair loss, the root causes may be complex and you need to figure them out in many cases. But the problem itself, you don't need to think about too much whether you have it or not. It is crystal clear whether you have it or you don't have it. And then the big kind of question for us was why don't men actually do something about those problems? And the answer to that, we believed, was some of it had to do with education. People were not aware that there were solutions to these problems, which, again, it may sound like really obvious right now, but many men didn't. They had this idea that there is Viagra, that it's for older men who will go and get it from their doctor. But they didn't really understand the nuances between different medications. They didn't understand overall kind of how these things work and the different contributors factors to those problems and what they could be doing about them. But more crucially for us, we just wanted to motivate action and get people to understand that there were solutions for those things, and then kind of create a little bit of energy to get them to do something, which is where we started kind of being a little bit more loud and provocative and attention grabbing. That was kind of the beginning. Call it latent demand, call it behavioral and societal kind of issues that were stopping men from they were getting men to deny themselves the solution. We didn't think too philosophically about that stuff. We thought, what it is that we can do, how can we get started? And then we just went ahead and did it.
That's really interesting, because it comes down to, for me, or what comes up for me there is like, what problem are you solving? And you're right. You're solving a problem of people not actually being educated as to what the potential actually is to get treated. So someone that doesn't understand the fact that, there's a physical reality to some of those conditions, but there might actually be a root cause. I guess you creating a commercial model that allows you to do the bold marketing and all that sort of thing is going to, as you say, encourage action, which is awesome. And so my question sort of becomes on the positioning of this in a world where we have a national health service that does a job. It struggles to stretch that job anywhere near towards prevention. There's clearly a gap there. Is that where Numan fits? Does Numan fit in the gap where things are falling between the cracks? Is this what supports those people, both from a prevention point of view, but also the groups of conditions that fall between the gaps? Is that where you see Numan fitting?
Yeah, and also this is, if you think about where we're going overall and some of kind of the big issues that we have and we need to solve, especially when it comes, let's talk about health as a whole and the population and the whole ecosystem, including the NHS, including ourselves, including private healthcare. We do have a productivity issue right now when it comes to health. That's kind of really what it boils down to, right? And when I mean productivity, I don't mean individual productivity. I'm talking about system productivity. It is really hard right now to find enough clinical professionals. It is really hard to actually create conditions where you can help them practice medicine at the scale that the problem demands. And it's also really difficult to find the financial resources to do this in a way that, again, would really shift the course, would change the course that we've been heading towards, right? We are in the UK, unfortunately, the most obese nation in Western Europe.
Really?
Adult obesity. Yeah, we are the number one in terms of adult obesity and population that is overweight. 30% of the UK adult population is now obese. That figure was close to 15% in '93, and another 40% is overweight. When you look also at cancer survival rates, we don't do well. When you look at the availability, the availability of scanning facilities per 100,000, people, we're very, very low. When you look at waiting times, and when you look at kind of all the pressure and some of the tasks that are just seem insurmountable challenges that the NHS has to solve, and I'm very confident that they will solve them. And we all collectively need to figure out how to work together and solve those. You need to find ways that you can engage people you can meet them where they are and solve problems that don't need to be solved by the NHS. But then as we become a more mature business, a more mature platform that can actually tackle and take on areas of health that are riskier and more complex, that's where I see us also being able to work in a much more connected way to other parts of the ecosystem. And that's especially when, let's say, some of the things around prescribing somebody a PD5 inhibitor to help with their erections. It does require oversight. It does require work that you need to do, but the touch points are not, they're fairly limited, right? If you're speaking about working with somebody in areas of their health that involve their hormones, for example, if it is testosterone for men, it is menopause for women, if it is helping somebody with their obesity, the touch points that you need to have to actually figure out where that person is, to find the right pathway that they need to follow, that includes both the pharmacotherapy but also the behavioral change, that then becomes to achieve optimal results, you need to approach it in a way that is complex. And the only way that you can do this at scale is if you figure out ways that you can use technology that are safe, that still let our clinicians do the best job that they can, but they actually massively increase the engagement that you have with that individual. But the only way that you can do that in ways that you can have impact at the population level is to figure out a way to use data technology to do that. And that's kind of the really exciting part of where we are right now, I think, as an industry, that you're starting to see some of those things really fall into place very differently to where, let's say, online pharmacies used to be 6 years ago when we're starting, which was the closest analog to what we're doing.
Yes. Because I guess what you're saying is that you have the ability to do what potentially isn't scalable to learn what is. And I think that's the thing with technology, is that companies like yourself can do the work to find the model that is then proven from a health economic perspective, which can then be used for NHS services going forwards, which is really interesting. So it might be worth us talking about another example of how this all kind of fits together, particularly what you talked about with, the behavioral change side, having to work alongside the pharmacology and that side of things, which is obviously the weight loss situation that we have. You mentioned obesity. You mentioned we're, like the most obese nation in Western Europe. But there are these things that have hit the market, which I know you know a lot about, which are, the GLP-1s and et cetera. So it's interesting because there's, I think there's a lot of narrative that I've seen around I think there's a lot of misunderstanding as to what they are, what they can do. And I think what you've described of, okay, there's this medication that's come out, it can suppress appetite, it can tackle obesity. People will take that a little bit literally. They don't do the behavior change. They don't do the lifestyle. It ends up on the black market. People try and lose a few pounds. Horror stories, hits the news. They get a bad rep. They get a bad name. And yes, there are side effects, but the whole point is there's a side effect profile. There is a risk profile. But there is also a side effect profile and a risk profile of being obese, and the risk of cancers, the risk of blood pressure and cardiovascular and all the rest of it. And so it has to be this way. It has to be these things, and all of this is why you need this sort of clinic approach is my understanding. And, the drugs can help kickstart something, but it's then the whole behavior change and the clinic side of things that has to teach you about lifestyle in order to maintain it and all these different things. And that's how they can be used for good. That's my understanding of high level what's going on. So, you know a lot more about it from being in this, and obviously Numan is set up to do this clinic version of this. So do you want to sort of talk me through it? And I guess, I went to your event at your offices, and you had clinicians talking about this, about the way that the clinics work and things, but it'd be really useful if you can sort of talk through that for us and the listeners, just to kind of give us the lay of the land of maybe what was the world like just before these hit the market, and how can the world be made better with them, if indeed that's what you believe?
Sure. So it's a lot to unpack there, but just quickly on some of the stuff on the abuse and some of the bad actors that you hear in the place that are just acting irresponsibly. There's absolutely there should be no tolerance and no place for that to happen, right? This is serious medication. It needs to be appropriately managed, tailored to the individual, and then monitored. And the conversation about them is so fascinating, though, because it goes back a little bit to the perceptions and attitudes and behaviors that we have around obesity. And obesity is massively stigmatized, misunderstood, and it's the last place where we're actually making judgments that we wouldn't make in other areas of health. If I can give you an example, from a personal experience, when I was 40, let me back up. I did my first blood test, I think it was my late 20s or early 30s, where I did kind of a preventative test to see where my biomarkers were. And I got a result for high cholesterol, which my father has suffered from all his life, right? I didn't really do anything about that. Of course, I didn't think about taking statins for my cholesterol when I was 30, right? So I kind of left it, I ignored it. I did another test when I was 35. I did get another high cholesterol result. I really zeroed in on diet, exercise. I tested again. My cholesterol was low at that point. And then if you fast forward to when I was, I think, 41, I was in Greece during the pandemic. I was there for a few months, and I just thought, I'll just go to a hospital and do like a full set of tests, because they are a lot more accessible and available in Greece, and you can just self-refer and go and get everything done. I was also curious. And I did a CT angiogram to look at just my arterial health. And it turns out that one of my lower arteries is 30% blocked, and I have early onset of atherosclerosis, which is, nobody knows how many 40-year-olds walking around with early onset of atherosclerosis, because nobody goes around and does CT angiograms for 40-year-olds. And of course, after that, and even at that point, my cardiologist at the time was, do you want to go on statins, or do you want to try to reduce it naturally? And then I wasted another year trying to reduce it naturally. And then at 41, I was like, what the hell am I doing? I need to be addressing this now and stop it in its tracks. So since then, I've been using statins. And I spoke to a number of different doctors at the time who were talking to me about statins have side effects. Statins, you don't want to start them. And I did the Q-risk score. And of course, my Q-risk score is very low because my BMI is healthy. I exercise. I don't smoke. So my 10-year risk of having a heart attack is very low. My 40-year risk, though, of actually having a serious cardiovascular event is significant. So the approach that we're taking to using pharmacotherapy preventatively is statistically, they never really made sense to me. And actually, you know what? Now guidelines around statins prescription are changing. And of course, with side effects, you might experience them, but you can change or stop the medication if you have them. And yes, you need to do some tests to see if your kidney function is fine after you start on statins. But it is a safer approach to be proactive and engage with a problem and solve it, even if it involves you being on medication potentially for the rest of your life. Or you can gamble around it and rely on a fairly weak, fragile system, which is yourself, your circumstances, your motivation, everything else that is happening around you. So nobody comes to me and says, why are you taking statins to actually treat your cholesterol? You should be doing this, naturally. Of course, from an economic perspective, let's park that on the side because my statin is a very, very different, much more affordable drug than GLP-1s are today. But the same approach that we're taking to these types of diseases that eventually will lead to either preventable premature death or they will evolve like obesity to diabetes to potentially cancer to a whole bunch of other things. This is how we think we should be thinking about the use of these medications to treat individuals who live with obesity. And we equip, and also it's important to think about the catalyzing effect that putting somebody on treatment has on their behavior as well. For somebody that has been fighting this problem all their lives, to tell them that actually you just need to eat better and exercise more, sleep better, and just manage the problem. For a lot of people, that is a mountain that they can't even take that first step towards climbing because they've tried before and they failed and they've been living with it. And you give them an opportunity to actually get a reliable support that is shown to actually deliver results. And then you support them with all the things that they need to be doing that most of them actually have a good sense, but they need, again, that support. And you can get them to a very, very, very different place. So we're still discovering exactly what these populations will look like over, in the years to come. We know there's a lot of innovation that is happening in the space. For me, I think we've just passed a very, very important, we crossed the door. I call them gateway drugs, but not in the sense that it's a gateway that leads to a very different place to when it comes to treating these conditions that have not been traditionally viewed as diseases, because you can approach them in very, very different ways. And we're starting, it's the only chance that we have of actually fighting this epidemic. Side effects, of course, they exist, but you can manage them. Risks with any medication, they do exist, but that's the alternative is that we just try things that, but by the way, also, this doesn't mean that this is the only thing we should be doing. Absolutely, we should be educating, especially when the children were growing up. We should be providing easy access to exercise, to sport. We should be thinking nationally about nutrition and about the products that we're actually consuming. We should be doing everything else that we can to get people. It's the biggest thing you can do to make somebody healthy is to get them to stop smoking and to then help them with their obesity. And then, of course, they can exercise more. Then, of course, they feel better. When you exercise and you put them on a kind of virtuous loop as opposed to kind of that vicious circle and that downward spiral that a lot of people find themselves in.
You mentioned that as a new technology, I say new technology, it's a drug, isn't it? But it is a new technology. It's not as cheap as a statin, and that there is a cost associated, and therefore an organisation like the NHS then needs to prioritise who they give it to. So I guess obviously we're talking about this from a Numan perspective. You guys are helping with this, but people can access it on the NHS. is it the case that, or you tell me, like, what's the situation with the fact that some people can get it on the NHS and some people have to get it elsewhere? What's going on there?
So, like everything else that we do, right? What I believe is the choice and the decisions that you can make as an individual. Of course, I'm not talking here about clinical safety and decisions that your doctor should be making to you. But if you want to get access to treatment and you are prepared to pay for it because you want to get it faster, or because you want to engage in a different way with your doctor, you want to engage differently with the behavioral change support that we provide. With Numan, when you just to explain what we do, when somebody comes to Numan, if they are accepted as a patient, they're connected with a doctor that they have access to. They're onboarded on a mobile app that has access to a coach, the doctor, and our support team that they can chat to. That app as well has dedicated content that is anchored around the 4 pillars of your health: sleep, mindset, exercise, nutrition. And then they get this personalized program that includes the medication, the clinical and coaching support, and the behavioral change programs that we provide, which is a different experience that if you go to your GP. Also, right now, and if you look at the numbers, I believe the NHS will need to prioritize the people that are at the highest risk. And I know this may sound, disingenuous, but we do want more access to these medications at the national level, because this is the right thing to do and it will make everybody healthy. And we do want, that's kind of what drives me and what drives everybody at Numan, to make people healthier. You can also make the economic argument in the long term that the NHS should be really investing in actually solving the obesity issue through the use of GLP-1s. The challenge and the question is where does the money come from to do that? The budget for the NHS last year was £187 billion, and about 155 of that was spent on staffing, medicine, kind of day-to-day operational costs. And then about 80 billion of that was spent on staffing. Now, with staffing, there needs to be an adjustment, and there will be an adjustment on the levels of pay for staff across the NHS. And then when you add the numbers there, when you look at the population that is obese and you're trying to come up with an estimate of what it would cost for this to be a national priority and treat everybody in the country that is obese with these drugs, you're left with some figures that are just very, very difficult to come up with. So, but I believe, there's nothing, if somebody's prepared to pay out of pocket because they can get to a healthy weight and they can be healthier at a level that is comparable to a gym membership, and they're prepared to do that, why would they not do this if they can get there, and if they can do this much faster, and they can do it in a more holistic way, and be something that they can do with their own resources? I don't think we should be expecting the NHS to provide this to everybody and anybody. But it's the big question right now with GLP-1s: what will be reimbursed and what will be self-pay at the global level? But we'll find the right balance as an industry, and I think there's going to be also new medication that is coming. There's going to be new treatments. There's going to be new different personalized pathways that you can build. And there's going to be part of the population that will be treated by the NHS, part of the population that their insurance will cover, part of the population that maybe their employer will cover the cost of GLP-1s, and part of the population that will pay for this out of pocket.
Yeah, I think from what you're saying, it's the fact that, you're absolutely right. The NHS has got to they've got to prioritize what the NHS can get ROI on, because as you say, there's not a bottomless pit of money that you can invest in all of these drugs. It then takes time to recoup that saving in all of the people that would get diabetes, would get chronic disease, would get all of those things. That's all the money you then would be spending on the diagnostics and the treatment and the inpatient and the outpatient and all of that sort of stuff. But that's obviously recouped over time. So it's very difficult unless you're going to take a £200 billion loan from some country to then go and pay for that. We're going to struggle to find it, as you say.
It's hard. And also the long-term usage is the big question as well. That you don't know exactly how long people will need and want to stay on treatment. So that equation, figuring out the overall numbers and the investment that you need to make is a tough one. But you know what? Despite all of those challenges, directionally, collectively, we are heading to a better place than we would otherwise be, and that's the exciting bit.
It's a really nice framing of it, actually, that you talk about as an industry. You know, you mentioned as well, like, you know, it's disingenuous for you to say it, but it would be best if the NHS would stretch that further. But I guess you're part of that story, aren't you? You're part of the story where you're figuring out that health economic model right now. You're helping create that data almost, because if you assume that more people who would benefit will get that treatment from people like yourself, those people that are benefiting, we're going to learn more about how long they're on the drug, what the effectiveness is, what the payout is later down the line, and how they look healthier. And the more data that's collected, as you say, the framing is sort of we as an industry. I kind of like that you know that you hold this position in the industry as a whole, and that actually you can contribute and you can change that. I think it's a contentious point. We struggle to talk about commercial stuff in healthcare. It's a tough one, but we know that there's always been a place for things like insurers in the private sector. And I can remember even when digital health first started, really getting popular, there were questions from, clinicians that have been around 30 years, like worried that things were being privatized. Even that's not the case. It's just new technology coming in. So I get that there's always fear and difficulty around commercial conversations. But what I do know is when you have that framing as we as an industry, there is always that sort of spearheading innovative component of that industry that is going and proving things and taking risk and putting capital behind things where a public organization can't, just in order to do the experiments to figure things out, which I think, as you say, we in industry, it's important. The thing that I want to ask about, you mentioned if they qualify as a patient with Numan. Obviously, one of the contentious issues around this is, when we think about black market use, is that people try and lose a couple of pounds and then end up taking the drug, and then the side effects outweigh the potential benefits, and then people are in trouble. So what is it that, obviously, there's what the NHS will classify as that makes you an NHS patient, but then there's, I guess, your definition of it, which is probably like what makes you a patient for whom this will affect positively. So how do you guys define that?
So we do follow guidelines by NICE on, prescribing criteria. We do have our own SOPs, of course, as well, but they're based on NICE. Right. We verify the person's identity. We ask them to verify their weight. They send us the pictures. We make sure that the person is qualified and it's the right approach. It's the right treatment for them. We also, the thing I want to stress is that if people are thinking, if they're listening to this podcast and they're thinking that this is a short-term fix, that you should be using these medications because, I don't know, you want to lose a little bit of weight, that, like you mentioned, because, I don't know, you have something coming up, there's the summer, there's whatever. You should not be starting treatment on GLP-1s unless you're prepared to really engage with this medication for a prolonged period of time, for a minimum of 6 months. You should be thinking about it for at least a yearly commitment, because it takes time for your body to get to the right dosage, for you to achieve the right weight loss, for you to also implement the behavioral changes. You need to take this seriously. This is serious medication. It's a serious problem, and you need to take a serious approach to it. if you do use this medication and you start treatment and you stop it after a month or after 2 months, you will lose weight, you will put it back on, you will put more fat back on rather than muscle, because of course we do lose muscle with GLP-1s or without GLP-1s. If you lose weight, you will lose more muscle than fat for most people. But the effect will be more pronounced with GLP-1s. And when you get back to your previous weight, you will have changed your body composition negatively and you'll have more fat than muscle. So don't do it. And I've had, friends that have talked to me about this, and I was like, just stay completely away. These drugs are not because you just want to, look good for the summer. This is for people who live with obesity and they need to do something about the problem. And this is what I believe will be the shift in perception and attitudes, and where the industry will also move directionally. And you're seeing some of the stuff that you see now in the press are symptoms that perhaps, there's still that kind of excitement, or that kind of, maybe there's misinformation, but the approach that we're taking, I think all the serious players are taking, and also where the patients will also be taking, is that this is anti-obesity medication. It is not a quick fix to just look better.
Yeah, definitely. Talking more about Numan as a whole now, you mentioned obviously as part of the kind of the stack of things that supports each individual patient that goes through your services, you mentioned technology playing an important part. You talked about it, helping, drop costs and make things more sustainable and that kind of thing. And, we've already talked about companies like yours often finding models that, the NHS can look at and learn from and that kind of thing. What role broadly across the company does technology play for Numan? And where are the places that you're kind of experimenting with technology?
So technology is it's at the heart of the business. We are a clinically led organization at the core of it. We treat patients, right? That's the thing that kind of comes first. But the DNA and the way that we do that is enabled and empowered and augmented through technology. And the if you like, the ethos, the reason why I exist is because we are a technology company. For me, what's really interesting is the way that some of the things that we've built in the platform lets us remove friction from different parts of your kind of healthcare experience. So we now make it really easy for you to start treatment, do a relevant personalized blood test, do that whether it is, it's going to be through a capillary test, whether it's going to be through you going to a partner clinic, whether you're going to have like a nurse come to you. We then let you understand the results, and we put that all in the same environment. And we're starting to create kind of these pathways that go a little bit, they start spanning different steps and different parts, and start going from like this single experiences to this interconnected experiences. And doing that in a way that actually, again, the user experience, make that compelling and make it frictionless and make it engaging. That's the thing that's very, very exciting.
Does it take you back to your engineering and neural network days? Are you building any of those for Numan?
It's obviously that's very exciting. What is happening with AI? We're evaluating where we are as an industry as a whole on that. There is the promise is there 100%. How you do it and how you introduce it and how you do that safely, that's something that we're still, we need to see. For me, also, the big question is going to be, as always, it's kind of that demand part that we're saying. How do people want to engage with the product? And so there's a lot, I think, to be, we need to figure out there. But yes, if you see kind of directionally where the industry is heading, it's hard to see kind of neural networks and machine learning and AI not playing a big part of that, right?
Indeed.
I should have stuck with it. I should have maybe pursued that path a little bit more. But
I don't know. It seems to have worked out okay. Well, yeah, it's also never too late. But yeah, things seem to have worked out okay. And yeah, I think it's more at this point in your career that at least you know what to ask of somebody else. That you've done that, so you could put a team on it.
I do joke with our team that I call myself an engineer, but they just don't take me seriously when I bring that up, and I don't blame them. But I am at heart and in spirit.
Speaking of team, you've undergone probably quite the evolution since you were 6 people to whatever you are now in terms of numbering your team, and the event that you had at your office. The latest hire that you'd made, I believe, was it a relationship and sexual psychotherapist that was on stage, Ben?
Yes, Ben is working with us. Yeah.
Yeah, which is
Dr. Ben Davis. He's amazing.
Yeah, Ben Davis. That's it. Yeah. Because we exchanged a few messages afterwards, and because I remember saying it because he was a GP, and that was what he specialised in. And I was thinking afterwards, like it's a heck of a hire that for you. I remember saying to you in the event, actually, like that's a heck of a hire for you, because for me it just sort of shows the breadth of what's required if you are to treat conditions like you are truly holistically. Like if you really want to treat those sorts of conditions, you will make hires like that, which I think was for me, it was just a really interesting signal as to kind of your approach and how you actually want to go about things. Because I think people can talk about this clinic approach, and they can talk about, and there's a way of doing what you're doing by ticking the boxes, right? And I think there's a way of doing it that actually signals a lot of intent. And I don't know, when I was listening to Ben talk and just the way that he was going about things, I found it genuinely fascinating and genuinely interesting. So I don't know, can you talk to me a little bit about your team and the way that you're building out to kind of these sort of fringe things that affect all the conditions that you treat, but I guess the role that plays in holistic treatment?
It's one of the most rewarding things, actually, and it's fascinating, and it's also one of the most challenging and one of the most rewarding things that you can do as a founder. And what I mean by challenging, finding good people to work with is always a challenge, but also changing the nature of the team and the composition of the team as the business changes. And I used to be very uncomfortable with the word transformation within a business, because it made me think of, like, I don't know, big consulting projects and things that we would do back in my Vodafone days. And then I became a lot more comfortable using it, because if you're not transforming how you operate and how you're set up and especially your processes, but also, when we talk about creating technology and a brand and being a clinically led organization, and also tackling different kind of complexity and risk, you are going to have to keep evolving as a team across all parts of the organization. And that's a hard thing to do, really, really difficult thing to do. It's a cliche, but it is the hardest part. But we're seeing how that kind of changes what we can offer to our patients. We can see how that is kind of keeps pushing us forward. But it's also one where you kind of need to keep challenging the team and yourself to accept it as well, right? And if you're not prepared also to change as a person and as a leader and as a kind of founder as the company grows, again, you have no chance. And you need to be comfortable accepting this, and not only accepting it, you need to make it part of your job to be the most open towards those things, because you keep finding stuff that you just never have done before. And I used to be, for me, the biggest change was within my first business. I was very insecure being the changing my mind or being questioned or being seen that I didn't know what I was doing. And I became a lot more comfortable with that. And also, when it comes to working with investors, being open about where the problems are, what is not working, what you are not really sure of and you want to discuss and you want their inputs, but at the same time, having a view and having a plan and leading the business. And that's also what makes it fun doing this kind of stuff. Fun is actually probably the wrong word to use here, but it's the growth and the rewarding part of it.
Well, I think that's the nature of entrepreneurship, isn't it?
It is, but we are hiring for a bunch of roles right now. If I can just plug that in, and especially where the business is right now, the kind of people that we're bringing in, the kind of infuse and kind of are changing also what we do as a business, how we operate as a culture. Lots of time spent on that.
Yeah, I think entrepreneurs are born entrepreneurs, if there is such a thing, or people that have learned to be entrepreneurs or whatever it is. But I think entrepreneurs are attracted to that challenge. And yeah, you mentioned it's fun. It's a word that's used a lot on this podcast, right? Like for very challenging times. But you don't become resilient without going through hard times. You don't become calm and chill without going through things that make you appreciate the calm and the chill. And so we're paying the future piece forwards, aren't we, with this chaos? And we have to sort of last through it and just know that those hard times are teaching you something as well. But yeah, I find this stuff fascinating.
It is, and you've been doing this now for 6 years as well.
Oh, the podcast 6 years, yeah.
The podcast in the business,
almost.
Yeah. It's and your team in the business has grown significantly during that time as well. But yeah, if you don't enjoy it, if you don't find ways to make it step back and kind of evaluate and see, even when you're going through the more challenging times, then it becomes tricky.
Well, and part of that is self-care, isn't it? Which is sort of why we're here, is why we're talking about this. It's why, you guys exist as a company, because if you don't have that sort of self-care built in, whether that's through diet, exercise, regularly testing, for things that can affect the way that you live. I think particularly as an entrepreneur, someone that, you're not going to get sick pay for very long as an entrepreneur, like, because you're the one paying and you're the one making those decisions. And so it's a form of self-care, I think, just having these things around that are going to support you with your health and those types of things. And so you mentioned proactive, right? I'm as guilty as anyone for like almost head in the sand when I know that something might be off and I'm just thinking, I'll give it some time and it will be fine. It will pass. And the problem is most of the time I'm right. That's the problem, because then there's the odd niggling thing where I'm like, I definitely should have got that sorted earlier. Unfortunately for me now, it's just little things that aren't going to be too bad, like a acute on chronic Achilles flare up or whatever it is. But you're right. Like when it comes to, coronary arteries, who knows what's actually going on without being more proactive than I'm being. And, as someone that's got a business and a dog and a house and a family and a kid on the way, like these are things that are on my mind now about being far more proactive, genuinely, with this type of thing, which I think is great.
So in being proactive, but also, again, as a founder, I became a lot more aware that it's not. I used to be very guilty about taking time off for holiday, or taking enough time off to work out, or showing up in the office, not the first one in, and I realized how stupid that was, and also self-limiting, and how much you actually have to make that a priority. You need to do that for your business and for your team. If you don't do that, you're doing a disservice to them. So it's not like it's not smart. You got to invest in that stuff. There's just, it's your responsibility as a leader to do that, and also to make the team aware that they need to be doing the same thing, and make them feel comfortable that they should be doing the same thing.
Yeah, there's almost like a nobility to it in the sort of hustle culture mentality, isn't there? To, as you say, first in, last out, never takes a holiday, works until goodness knows what hour. Like, it's a strange sense of pride amongst, perhaps, I don't know, the insecure, I guess, maybe. I don't know, but right.
Maybe it's also a question of, I don't know, experience and maturity, but you have to work hard for a very long time. That's the thing. And you also have to get people and a team around you and be alert, be positive, keep them engaged, give them energy. And if you're going to burn yourself out over, a month, you can try work for a month, 15-hour days and weekends, maybe work 2 months. See how you're going to do on month 3 if you do that with no exercise, no proper sleep, and no time off. You're not going to last very long.
With everything that we've talked about, whether it's something to do with Numan, whether it's something to do personally, what is something that you're excited about in the next few months, year?
Personally, family. My 4-year-old is starting school, and she's becoming a much more kind of fuller person. So I'm excited about her, and also kind of how just the fun it is to spend time with her now. With Numan, we have a few things that are coming up in the next few months that I can't tell you exactly right now what they are, but it's just been such a different world from where, let's say, we were 2 years ago. So I'm really excited about how the team is performing and how we're moving and how we're iterating and how we're learning. So actually, one thing I am really excited about is the proposition we're launching around hormonal health for men. So we've put together an amazing proposition that really helps you understand the importance of hormonal health as a man, really helps you understand where you are, and then really helps you, if you need support with that, making the right decisions that can keep you really kind of transform how you think about that and also optimize it. And that's launching soon, so I'm very excited about it. Lots to look forward to.
Yeah, definitely. So yeah, Sox, listen, it's been an absolute pleasure having you on. Thank you. It's been really interesting to learn your approach. I think Numan's positioned really interestingly in the healthcare space, and if there's something that I will take away from this podcast, it's that framing of we as a healthcare industry, and I guess all of our positions within that. We all perform different roles. The NHS, of course, and so many supplementary players, and I think it's really interesting to see where it fits, particularly around the weight loss and the GLP-1 stuff, but also more broadly across everything that you're doing for men's health and people more broadly. So excited to see you guys and what you get up to, but until then, it's been an absolute pleasure. If people want to learn more about Numan or yourself, what's the best way for them to do so?
They can go to numan.com. They can email me at Sokratis@numan.com, or just message me in the usual kind of channels, or of course listen to this podcast.